When many of us were growing up and we got into trouble, wasn't uncommon to get a whooping with a wooden spoon or a paddle, maybe even a belt. Now, if you ever heard about that type of corporal punishment back then, it really didn't seem like any big deal to anybody. Nobody really batted an eye. Times have certainly changed. Just take the case of Minnesota Viking star running back Adrian Peterson, who now faces child abuse charges. Peterson recently admitted to punishing his 4-year-old son with a belt and a switch. Of course, that's a small tree branch. Graphic pictures have circulated online showing the injuries all over the boy's body. Peterson has maintained he is stern when it comes to punishing his kids, but he is no child abuser. As a matter of fact, in a statement on Twitter, Peterson said this: "I have to live with the fact that when I disciplined my son the way I was disciplined as a child, I caused an injury that I never intended or thought would happen." Well, Adrian has certainly not been quiet about the whole situation. As a matter of fact, he even went so far as to request a polygraph test to prove that he's telling the truth. And you can see that tweet here. Peterson later claimed he passed that lie detector test. Well, the case has really brought to the forefront the debate over punishing children. When is it discipline? And when is it abuse? Talk to parents about the best way to discipline their children, and you won't get the same answer.
I think it's okay to paddle.
Even going as far as switches, belts, any of that stuff, that's taking it too far.
When we were growing up, I know we got disciplined with switches, and you even got paddlings in school.
Deb Sendek heads a nonprofit organization that provides educational information to the public on the effects of corporal punishment of children. She says even though corporal punishment is legal, she doesn't believe it's in the best interest of children.
A child should never be hit.
Sendek says research shows corporal punishment can hinder a child's ability to learn.
Children who have been hit with corporal punishment, oftentimes their language skills are lower than children.
Dr. Jonathan Thackeray, who heads a Center for Family Safety and Healing, says punishment crosses the line into physical abuse.
When they have prolonged pain, when they have broken bones, when they have disfigurement of the skin, so scarring from their injuries.
He says research shows corporal punishment is ineffective.
In the majority of cases, doesn't get the behavior change that the parent wants. And if anything, it makes it more difficult to change a child's behavior in the future.
In a quick survey, none of the parents endorsed the punishment inflicted on Adrian Peterson's 4-year-old son.
I wouldn't use a branch. No way.
For a child that age, yes, I think a switch is a little extreme.
That's horrible. Yeah, that's absolutely horrible.
So where do you stand? Every parent arrives at that moment when they've got to punish their child, but do you know how much is too much? Well, joining us today to help us answer that question, I just want to make sure I get your title right, psychologist Michael Finegan, who is the director of Peninsula Mental Health Services and member of the Department of Psychology at Peninsula Regional Medical Center. Thank you so much.
You're welcome.
For joining us. It is so easy to go too far when it comes to punishing our kids, isn't it?
Correct. It's a balancing act, and it has always been a balancing act. The most effective punishments is to reinforce the child, but there also has to be consequences.
Right.
There's consequences in the real world, and we teach our children about the real world by how we parent them. But it's a balancing act. Primarily, we want to be warm and supportive, and we really want to avoid, for the most part, corporal punishment.
I was just getting asked, so in your opinion, you think that punishment as harsh as corporal punishment can impact the child down the road?
Well, excessive corporal punishment can impact the child down the road, and corporal punishment should never be used as the first punishment. Again, we want to be encouraging the child. We want to be warm. We don't want to be frightening to the child. And when we're raising our hand or using a switch to smack that child, we become scary. The most powerful and secure object in the child's life, remember, they're not small adults. They're children.
Right.
And then this person that provides for all of their needs, hitting them as a primary means of punishing them or controlling their behavior is not a good idea.
Okay, so we've mentioned corporal punishment.
Right.
How would you define corporal punishment?
Corporal punishment is laying hands on the child. It's hitting the child. It can be hitting with your hand or hitting with a strap. So it's not really having to do with the level of intensity. It is the striking of the child.
Okay, so what do you say to the parent who says, well, I try grounding Johnny, it doesn't do any work. Well, I try to take Susie's toys, it doesn't do any good. What do you tell them?
Right. Well, have parents understand is that you have to change the economy. What is important to the child? You know, for me, you know, if my wife takes away cooking Brussels sprouts,
right,
it's not a real big punishment for me.
Right.
And so you have to see what's important to the child, and then immediacy is very important. Particularly for a small child, punishing them an hour later, their misbehavior at the mall for the 4-year-old,
okay,
and then you're taking away ice cream 2 hours later, that has no effect on the child. You look at whether or not there's other problems, because a child can show stress by acting out. So if something that used to work is no longer working, you ask yourself the question, what has changed? Does little Johnny or Mary have a temperature? Are they being bullied at school? But when we have a pervasive problem with not listening, being oppositional, being defiant, then you have to talk with the pediatrician or to the child specialist, and you start looking for some other problems that may be present. Now, certainly, attention deficit hyperactivity disorder is way overdiagnosed in our society. Almost a 400–500% increase in that diagnosis. Obviously, we've not had that many children develop that disorder overnight. But that is a problem for some children. It makes it difficult for them to listen, so they continue to make that same mistake over and over. So when there's a long-term, pervasive problem with not listening, I think it's time to bring in an expert to assist and help guide the parents. That you want that consistency, because when little Johnny says, oh, please, 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 just give me one more chance, so mom has said it 5 times, and then starts screaming. What we have taught Johnny is then you have to push it 6 times before you get your way.
Okay.
Right.
Right. Now you had mentioned, I just want to ask you about this. You had mentioned the immediacy of the punishment is important.
Yes.
But
and the reinforcement.
And the reinforcement.
Yeah.
But what if that immediacy, I mean, it just happened, now I'm angry. The immediacy, what happens if I just lash out right then? Yeah. What do I do?
We're very visual, you know, and what we use with our patients in our practice is the concepts of SOS, the International Distress Symbol, stop, S, orient towards the problem, what's going on, and then surveying the options. It allows you to take that mental step back, or what we refer to in hostage negotiations, going to the balcony. You know, you're a player on the stage, but you're looking down from the balcony, observing the situation. So you're reflecting on what you're doing. You're taking that pause. And there's lots of techniques that we use for treatment of anxiety, where we're getting individuals to stop, to slow down, to use techniques that very rapidly calm them down. That's another technique that parents can use.
Okay, so I didn't reflect. I lashed out, I made the punishment. Is there any way I can kind of back up and make this good?
Well, again, we teach our children that dad or mom can admit to a mistake, because we want honesty, we want transparency in our relationship. So if you make a mistake, we're human beings. We all make mistakes. The people that have the greatest degree of difficulty is when they can't admit to making a mistake. Human beings make mistakes. We acknowledge it and we address, and we don't avoid the problem. Rule number 1, address and not avoid the problem.
And the child learns from that too.
That's right. They learn from us through our actions. How we act, they pick it up. So you want to create a yelling child or a yeller as a boyfriend or a girlfriend?
Right.
Parents are yellers.
We got to quit that.
Right.
Dr. Michael Finegan, thank you so much for your time.
You're welcome.
Afternoon. Now, if you would like to know more about what Dr. Finegan just had to say, all you have to do is go to our website, wboc.com, and click on our picture at the top of the page. Well, another place where parents play an important role in bringing up their kids is how they treat their significant other. Remember this phrase, more is caught than taught. Whether it's mental or physical abuse, how your children see you treat others will impact them for the rest of their lives. Unfortunately, Lisa, many kids see one or both parents get physical firsthand.
Yeah, Jimmy, according to safehorizon.org, domestic violence is on the rise. A new study shows that 1 in 5 men reports being violent toward a woman. But experts say it's not just an adult problem. Domestic violence is becoming more prevalent in teens and young adults. In fact, Females ages 6 to 24 are the most likely group to experience an abusive relationship. So what can these young women do to protect themselves? Well, the answer may be more simple than you think. It may lie in this device right here. Now, just a warning, the video you're about to see is a bit graphic. A push, a shove, a punch. Domestic violence comes in many forms, but they all cause fear and pain. Dreaming of mercy. Now, these forensic nurses have developed an app to help young victims. They say age-old informational brochures just don't work.
If seen by the perpetrators, their abusive spouses or boyfriends, get them beat up.
The app, called Be More Safe, offers victims information about their options in a discreet way. It also provides access to a 24-hour hotline, a direct link to 911, and GPS instructions to a nearby ER.
Technology is the best way right now to get the word across.
1 in 5 female high school students reports being physically or sexually abused by a dating partner. 57% of teens know someone who's been in an abusive dating relationship, but 81% of parents in one survey said they didn't know or didn't believe teen dating violence was an issue.
Domestic violence information.
The experts recommend that all young women seek resources for domestic violence.
We've been encouraging them to have it on their phones just in case.
High school students Gabriella and Elise have downloaded the app. Elise has known girls in violent relationships.
It's just awful because they don't know what to do, and I'm a friend, and I don't know what to do for them.
Girls are really good about hiding stuff.
The Be More Safe app is free. You can download it to help keep your family safe. Well, continuing on the path of keeping your family safe, we'll find out how to be sure you and your family's end-of-life wishes will be respected. Still ahead on Delmarva Life, we'll hear how this form can help.
Plus, we're going to hear about the thing many of us do, care for our loved ones. We're going to hear the story of one woman who gave all she had to the man she loved. Once they heard the diagnosis, you have Alzheimer's disease. Delmarva Life, we'll be right back.